Hi friends, welcome to the part of secondary amenorrhea. So in last and subsequent classes we dealt about primary amenorrhea. Now we are dealing with secondary amenorrhea. So doing with any case you should know what is the definition. So we are doing about secondary amenorrhea. So definition. Why do you think definition is important? To classify a patient to say her she is secondary amenorrhea. So according to Datta and standard textbooks, they say 6 months there is no menses, or if it's less than 9 cycles in a year. Okay. But clinically speaking, even if it's less than 3 months, we'll start our management. Okay. So you know the definition. Coming to our basic approach. See, why do you think I'm stressing on anat physiopathology? See, I know all are interested in clearing NEET PG. Nobody is here. Very few are interested to know the concept and actually deal with the proper subject as per se. But see, importance of INCT is that they focus more on your pre and paraclinical. So if you know your pre and paraclinical well, you're almost sorted. So that's why I say I include basic clinical pre and paraclinical subjects so that you know what you are doing. Okay, because sometimes I need to give a explanation, right? Because the world is full of, in today's world it's mostly you need to prove with proof, otherwise nobody believes you. That's a sad part, and that's also important thing. Okay, so coming to our basic approach, that is anat, physio, then patho. Correct, no? Same things, re. Okay, hypothalamus, pituitary, thyroid, insulin. Pancreas. Sorry. Your uterus and ovaries. Okay. See, if you sit in an OPD if you see an OPD of gynae, you know by now how many cases of secondary amenorrhea would have dealt. Okay, you should know. That is something which you should. Right, left, and center in OPD you see. Right, left, and I mean it. Okay, if you have seen, if you have gone, you know. And also one more thing is adrenal glands. Okay, so this video is of very very importance, paramount of significance, to know what you are dealing, to know what you are seeing. Okay, see, workup I will say later. Now see, if there is no estrogen, then there is no hormone. So basically the whole concept of workup is based on hormone. So this is something which is important. I'm not saying it's not, but the workup is basically dependent on hormones. To an extent where you cannot even imagine. Okay, it's all about hormone. So physio forms a basic gist here. So again, it's nothing but HPO axis itself, where hypothalamus releases GnRH, then it produces LHFSH, then estrogen, okay, then progesterone. In workup part, I will say first you need to think about all your hormonal causes. First you do something called as progesterone challenge test to check for endometrium. Then you do estrogen plus progesterone challenge test. This is first. This is second. Next you do something called as GnRH challenge test. See the order: local, very local, systemic. See, that's why the strata approach is important in gynec. Okay, so I will talk about the importance there. So, and also this is also to do something with hormones, right? So if any adrenal tumors which is producing excess hormones, excess androgens, it can block LH and FSH production, and again also she can come up with secondary amenorrhea. That's why I talked in anat part of it. So here the basic problem is anatomy will be normal. She has menstruated, no man. Then why do you think anat will be problem here? Least likely. It's almost to do with physio and patho. Anat will be normal. If anat was abnormal there, then she would come here, most likely 60-80% she will come as primary amenorrheic. Correct. You got my concept. Here physio and patho is something which is altered. That's why she is coming as a secondary amenorrheic case. Now we'll go with patho. This also forms a major thing. Okay. So infections. Okay. Any chronic infections like TB, or iatrogenic, she's taking any pills. I meant OCP, nothing else. And also, if she had any DNC in the past, so again you'll have chronic inflammation that heals by what? Nonsense, everyone knows, fibrosis. So that causes adhesions. What is this condition called as? Asherman syndrome. Correct. Then again, what do we have? All these benign conditions like prolactinoma, then pituitary adenoma, which causes obstructive lesions. And also you might have in malignant also in some conditions excessive is produced, usually if it's an ovarian malignancy or such. Also you can see some cases, you can see a secondary amenorrhea also. Okay. So this is the basic knowledge which you should need to have. So basically one important concept I will say, see, remember for God's sake at least this, the take home message from video is this. See, if uterus has to shed, what do you think should be normal? It is what, Ray? Say first. Endometrium. Okay, I know my handwriting is bad. Endometrium should be normal. To properly have a proper functioning endometrium, you should need both estrogen and progesterone. Don't only say progesterone. That is a donkey concept. I mean, not a good concept. See why? See, if estrogen is there, you need to know the menstrual cycle. What? Menses, then you have proliferative phase. Proliferation occurs. And if progesterone is there, secretion occurs. Then for progesterone to act, you need estrogen. If progesterone needs to act, I mean the receptors, estrogen should be always there. This governs the treatment modality. Mark my words. Governs the treatment modalities. Okay. So this is the basic concept. So even in bleeding, see, secondary amenorrhea, she is not having bleeding. That's why she is coming. So even bleeding, you can have either 4 types of bleeding. That is estrogen withdrawal bleeding, progesterone withdrawal bleeding, estrogen plus progesterone withdrawal bleeding, or local. So usually what do you think happens in a normal woman? It's this. Don't say this. I know all would have said progesterone withdrawal. No, it's both estrogen and progesterone. Okay. So this is what it happens in all women. So first in workup we'll discuss. Okay. So in broad, if you want me to classify them, what are the basic things which you need to think? See, in broad, if it's an hypothalamus related cause, if it's I am writing in ANAT because I don't have space. Please don't think it anywhere else. Hypothalamus might be due to stress. Exam stress is a very common in any weight. Pituitary, you might have adenoma or Sheehan syndrome, that is postpartum reduction of pituitary. Then in ovarian causes you can have PCOS or POI. In uterus causes Asherman, I would say. Then systemic or malnutrition. Okay. Then any chronic illness like diabetes. Okay, that is something which you need to do. Then basically coming to work, this investigations. Biochemistry forms the major thing. LH, FSH, androgen. If you know these things, you are sorted. And radiology is important in upper strata investigations. What do I mean? That means if you are suspecting something related to pituitary and your hypothalamus, then you do an MRI. Treatment, basic treatment I would say. Progesterone. That is one thing. Now I talked about progesterone Stalin's test or estrogen plus progesterone. You can do OCP. Then GnRH agonist. So easy. No, see, why do you think the first videos is important? because this gives you a basic general approach. If you know, you can extrapolate anywhere. Okay, so this is the gist of secondary amenorrhea. In next video we'll discuss the workup of secondary amenorrhea, and I say it is so important and so easy. I've taken it from data and I've explained because it has given, they have taught us so well. So please stay throughout that video also. So now you know, in this video we discussed about the definition, because we need to classify a patient whether is she a proper case of secondary amenorrhea or what. So you know, if a patient is secondary amenorrhea, you know that our basic approach of anat, physio, patho. Anat, the first chat approach, and nothing to do with, most likely, physio and patho than anat. Why? Because if it was something to do with anat, then she will come up with primary amenorrheic rather than secondary amenorrheic. So in physio, you need to know the HPU axis as proper, then also the hormones where it is produced, and this concept of endometrium, that is estrogen and progesterone, why estrogen is required, why progesterone is required, in which tumors is it blocked. Then in patho, we discussed about any infection which is causing it, and chronic inflammation in D and DNC, that is dilatation and curettage, how it leads to fibrosis and how it causes adhesions, and also benign conditions like prolactinoma and adenoma, and also some malignant condition, and also some systemic diseases, which is important. And also we discussed the overall approach, I mean in a broader perspective, what are the most common causes. Correct now. So in next video we will discuss about the workup, which is, and also investigations, biochemistry and radiology is something which is of paramount significance, and treatment also I told. And here treatment is not that, okay, here you have to do surgery, which we will discuss in next class. So next class, very 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 important. Even if you know this, then you can understand what I'm speaking there, otherwise you will not understand. So watch this video, then come to next class, so that you will have a proper idea of what I am speaking. Okay, till then, take care, bye bye.